Hi, my name is Meredith Caldwell, and I work at St. Francis Animal Hospital in Fredericksburg, Virginia. I'm a veterinary assistant there, and I've been working with my clinic for 4 years. In my video today, I'm going to show you how to properly clean a cage or housing area for one of our patients and how to clean a floor. The first thing I'm going to focus in on here is the kennel saw bottle, which is our cleaning agent that we use in our clinic. It is 2 ounces of kennel saw to 1 gallon of water. Bottle is properly labeled and has the warnings on the bottom that you can't really see very well. So when we start to clean our cage, which is going to come up here in just a minute, you want to have proper attire on. We have long sleeves, a coat over top of our scrubs, goggles, and gloves. The first thing we're going to do is remove any of the bedding, pans, food, and water bowls. Then we're going to take out our grate that our animals sleep on. Our cages are lined with paper in the bottom, so we're going to help fold that up, getting all the debris that we can out and disposing that in the trash can here. All right, and then we're going to take the door off as well. There are 6 sides to the cage: the front, the back, the top, the bottom, and that cage door that need to be cleaned. Then we're going to come over here and grab our cleaning agent. Now that the cage is clean of all debris, we're going to go ahead and start spraying each side. Left, right, front, back, bottom, sides, everywhere that you can. And then once we have this cage completely sprayed, we'll go ahead and let that sit for 10 minutes before we clean it out. So here we are going to clean our litter pan, our grate, and our cage door. We have a kennel in the back of our facility, so we will do all of our cleaning back here. So first what we're doing here is getting all the litter out, getting all that debris off. Then we have the bucket to the right, the red bucket, which is also a mixture of 2 ounces of kennel saw to 1 gallon of water. We keep that back there for scrubbing the grates and all sorts of things. So we're going to go ahead and scrub this litter pan up, scrubbing all sides on the inside and the bottom, and then we're also going to scrub the sides on the bottom and the outside. Once we finish scrubbing this, we will set it to dry for 10 minutes, and then it will be later rinsed off after that. Here we are, just making sure we get all the sides inside and out. Then we have a little area in the back that we will place it on to dry so it can have that contact time of 10 minutes to get your peak disinfecting of that litter pan. We just normally sit them, oops, we have a dog right there, over there. Alright, next we'll go with our cage door. Remembering to do the same thing, we'll turn the water on and rinse any and all debris off of our cage door. Making sure you get all the areas you want, any urine, feces, hair, blood, anything that the animal has gotten on the cage to be off before you start disinfecting it. And then we'll start at the top and work our way down, making sure that we scrub each and every area of our cage door. And then we'll do the inside of the door, the outside of the door, and all 4 sides, including the prongs on the ends that hook into the door. You just want to clean the grate as thoroughly as possible. So now we're going to do the tops, the sides, and once we're done there, then we will set it to dry or have that contact time of 10 minutes, and then we will thoroughly rinse it off and then let it dry once again before placing it back on our patient's cage door. This process can take a while, but you want to ensure that you disinfect all surfaces, even if the patient was healthy while they were there, and especially if the patient was ill or had anything contagious while staying in the facility. You just want to make sure you clean as thoroughly as possible. Alright, now we have our cage door. There is a little area over here that we will sit the cage door on to dry, or have that contact time of 10 minutes, and then we will rinse it again. Alright, and now we have the grate, and we're kind of going to do the same process that we've done with the litter pan and the cage door. All the debris needs to be rinsed off. These grates can trap feces, urine, blood, vomit, any kind of secretion that can come out of the animal can be stuck inside there. Taking a different brush, one of our harder bristle brushes, and ensuring that we scrub each and every one of the surfaces there, getting it as clean as possible. And we'll do the same things. We'll do this side, and then we'll do each side around, and then we'll flip our grate over and then clean that side as well. And then it will be set with the cage door for that 10-minute contact time, and then will later be rinsed when it has had that 10-minute contact time. And you still note all the apparel is still the same. Still have the goggles, the gloves, and the long sleeves, and the long pants, and the shoes on while cleaning the cage, just because if the kennel saw gets on your skin or in your eyes or even in your mouth, it can actually cause some issues. So you want to be as cautious as possible when using the disinfecting materials. Okay, now we have that done, and it will sit over here for that 10-minute contact time, and then we will rinse them off. Alright, now that we've had at least 10 minutes, we'll go back and clean up the spray off of the cage. Start at the top, do the sides, and just make sure that we get all of that debris off. We use paper towels, so there's really no laundry or anything afterwards. Just clean the cage and then dispose of the paper towels in the trash can. You want to also make sure you get the locks on the door, all the frame, everything very well. Okay. Now we're going to move on to our cleaning of an exam room or a floor. Alright, this is our mop bucket. It is also a mixture of 4 ounces of kennel salt to 2 gallons of water. So that's what we'll be using to clean our floors. The room needs to have everything off of the floor. So anything that's under the sink, we'll go ahead and take that all out. We'll make sure we remove all debris, hair, dust, dirt, grass, anything that could be on the floor. We'll go ahead and take our mop and get in each and every corner of the exam room and make sure all the dirt and debris is taken out of the room before we actually bring our mop in. Making sure to get it in all the corners, under all the nooks and crannies. Just make sure it's nice and clean. We do have a dust mop too, but with this room we wanted to use a more thorough broom to clean out all the debris, getting behind the door and any other place that you can see any dirt or hair. Get that all in one pile and put it into our dust pan over here.
Okay. For that one.
All right. Okay.
Film it.
And now we have our our broom, or excuse me, our mop. This is a brand new mop head. It hasn't been dipped into the cleaning agent yet, so we'll go ahead and get that wet.
Nah, once is fine.
And agitate it a little bit just to make sure it's not soaking wet when we take it into the exam room to clean the floor. So we'll take it in there, and we'll do the same thing that we did before. We will start in one corner and come towards the door, making sure you get under each and every surface, behind all of the corners, just ensuring a good thorough clean. We do this in the morning before appointments, between appointments, in the middle day, and then we also do it again at night. Just want to make sure you have a clean, as sterile hospital as you can, just to prevent any spread of any contagious or infectious viruses or diseases from patient to patient that comes into your hospital. And once we're done, we will turn off our light and then turn our fan on and let that room sit till it's dry before we use it again.